goes through the OBS screening
Tell me
interview.
what brought you to the hospital?
Policeman brought me to the hospital.
Policeman. What happened that the police would bring you there?
I was trying to get into my house, and the key wouldn't fit, and I knocked, and I rang, and there was somebody inside, and then next thing I knew, there were policemen there. And I don't know why they came. I was just trying to get into my house.
Where is your house?
Well, you know where it is. The policeman picked me up there.
Have you had trouble finding your house before?
Oh, no. No, I didn't have trouble finding my house this time either. I just couldn't, the key wouldn't fit in the door. It was my house, but the key wouldn't fit. And so I don't know what they came for. I really don't.
Have you had episodes of being lost? Forgetting where you are?
No, I know where I am, and I know where I was. I just...
Where are you now?
The hospital.
Which hospital?
Well, you work here, you ought to know which hospital.
What day is this?
Tuesday.
You sure?
I always do my laundry on Tuesday, and I did my laundry today, and then I went down.
The doctor uncovers several aspects. She shows lapses in recent memory, covering these with either laughter or hostility.
With some friends, and then I went back to the house, and my key
Where did you go for lunch?
Well, where I usually go, down, I don't remember the name of it.
What did you have for lunch?
What difference does it make? I don't know.
Did you have anything to drink?
A little bit.
A little bit like what?
Oh. You know, just a couple of martinis, I guess. I don't remember. I don't drink very much.
More than a couple?
She displays rapid fluctuations in mood and becomes sad.
This place is just like the place where my babies were born.
Where was that? Come back and sit down. Come back and sit down.
In order to deal with her rising anxiety, her interview is structured. She's told to sit down and told to be attentive. She isn't babied or humored, but is allowed to maintain her self-esteem.
Well, yeah, but they just brought me here because there wasn't, until they can find out what was the matter with the people in my house. I mean, I want...
Have you been brought to the hospital before? When you started to talk about your babies being born in a hospital, you got up and walked off.
Oh. I don't know.
You look sad.
have my babies anymore.
You don't have them anymore.
Isn't that pretty? Isn't that pretty?
We're talking about your babies and you show me your ring.
I think it's pretty.
She's confronted with some of the realities of her behavior, her fluctuating mood, her depression, and her memory lapses.
If you don't know what month it is, then I'm not going to tell you.
How long has it been since you were home?
I don't remember much. It's Tuesday.
Treatment should be structured to reduce additional stimulation of the patient, help restore memory and orientation, attend to rapid changes of mood, and reassure the patient that delusions and hallucinations are not threatening. In occupational therapy, we see the classic behavior of a brain syndrome patient. Asked to write her name, she comes up with the only thing she really remembers, Tuesday.